If you need a seat, just let us know. But I'm glad we packed in the house, and it's really interesting to see people in 3D. It's a little weird. And you guys don't have a little frame around your heads. So good morning. My name's Jack Tuan. I'm the COO of Illumination Foundation. Thank you for joining us this morning. We're super excited to be here and to open up this facility. It's been a long time coming, and I actually joined at the tail end of it just a little over 5 months ago, but I know there's a lot of people who've been very involved in making this happen, through a pandemic, no less, right? So this is a huge accomplishment. I want to thank a few people, especially our staff, who've quietly made everything happen and just made this place look ready to move in. But I also wanted to, a special thanks to also Justin Connors from the Kemp Brothers, who project managed this. I also wanted to acknowledge some people who are here this morning with us as well. Ben Harigi from IEHP, Jose John from Kaiser, David Smith, Principal Director of West Group Design, and of course our beloved board chair, Jackie DuPont Carlson, who's here as well. And of course, we have some esteemed official and representatives who are here as well. Mayor Patricia Locke Dawson, Councilwoman Erin Edwards. And we'll hear a little bit from them later. Councilman Jim Perry, Councilman Steve Hemingway, Councilwoman Clarissa Cervantes. We also have Assistant City Manager Rafael Guzman, and representative from Senator Richard Roth's office, Michaela Cruz. And also want to recognize Assemblyman Medina's office, Cesar Gomez is here. So to kick this off, I would like to bring up someone I admire very much. He has had an illustrious career in so many different areas, but in his last career as a public health nurse, caring for families on the streets, he saw that he could do better. Better for our friends, our families who are experiencing homelessness. And he gave up everything to start the Illumination Foundation, really truly disrupt the cycle of homelessness. So this is why I'm here. This is why many of our staff are here, just pouring our hearts out into this mission. And so without further ado, I want to invite our Illumination founder and CEO, Paul Leon.
Good morning. Wow, we are cozy in here, huh? So again, on behalf of our board of directors, and our new board chair, Jackie DuPont Carlson. Thank you all for allowing us to come into the city and work with this incredible leadership team from Riverside. You know, currently, the last count that we have was 500,000 individuals today that are homeless on the streets of the United States. 500,000 people. In Southern California, there's 72,000. Is that me? I thought I turned it off. My daughter. Probably wants money. But there's 72,000 in Southern California alone. And I think it takes time for us to really grasp that 72,000 people are homeless tonight in Southern California. And to open up this recuperative center and to really be able to do state-of-the-art work, cutting-edge work in a location in Riverside is really incredible. We really honestly feel that this is the national model. Yes, it's board and care, but it's so much more. It's wraparound services, and Pooja, our medical director, will explain to you why it's so important to do all the social determinants of health and to make sure that we do complete wraparound services to help these individuals in Riverside get to permanent supportive housing, because that's the only way we're going to disrupt our housing problem, our homeless problem. So I'm honored, and on behalf of our staff, to be here, because we came here to Riverside about 4 years ago. We had a little soiree in a shelter up the street, and we weren't quite ready then. We opened up a recuperative care in a shelter and realized, number one, that we need a bigger infrastructure, and number two, we really needed to have that continuum of being able to put people in a facility like this and move them through that continuum to permanent supportive housing. We didn't have that. And I'll explain to you just really quickly about why it's different now from then. We had a little bit support from Riverside, but the problem was so massive that they were trying to get their heads around it. Now that we have new leadership in Riverside, then we're a larger organization, we were able to put those things in place. And nothing could explain the situation better than the story about Agnes. Agnes was an 81-year-old female, and I remember it like it was yesterday, because I was here about 4 years ago. And Agnes's daughter dropped her off in front of our shelter recuperative care. Wasn't quite all it should have been. Dropped her off. We couldn't take care of her because we didn't have the medical facility to do mental health and deal with complex needs. We had a shelter where she could stay there, but it was everybody mixed in together. Men, women, mental health, substance abuse, all in one area. I remember talking to Agnes's daughter, and she said, I'm living with a roommate in a senior living area, and my mom was there for a week, and they gave me a notice to move. I had the choice of taking my mom here or us both being homeless. I don't know that I could have made that decision, but I felt her daughter's pain. And so she dropped her off and drove away. I felt helpless at the time because I knew we couldn't take Agnes either. We drove Agnes to Salvation Army and watched her walk in. I'm not sure what happened to Agnes. But today, if we had Agnes show up on our doorstep, we would bring her in here and care for her. So I think that is a tribute to Riverside, to our staff, and to everybody in this room for making this happen. Thank you.
Thanks, Paul. Really a great story to keep us focused on why we're doing this. Next, I'd like to invite our very accomplished Executive Director of Healthcare to say a few words. She spent her entire career serving the homeless community. We're lucky to poach her from Boston Healthcare for the Homeless. We offered her warm weather, but I don't know if she expected this kind of warm weather. So I don't think she knew Riverside. So we showed her the beach and everything. But so she came over. She's with us. I want to introduce Dr. Pooja Bala.
We'll talk about warm weather. It definitely shows how dedicated everybody here is, that everybody showed up on 85 degrees to really open this beautiful facility. So welcome, all of you. It's so wonderful to see everybody here as we today have been waiting for this day to open this facility, which have been in the works for many, many months. And there's so many folks here from the city, Justin from Kemp Brothers, our staff. We've been meeting weekly every Wednesday at 10:30 to talk about all the details, from the service model to what the doorknobs, what the HVAC, how the kitchen needs to look like. And it's wonderful to see how it's come together, and we're really looking forward to welcome all our clients here very shortly. So first I want to start, we could not have done this without the city's support. The City of Riverside provided us a nice grant to fund some of the capital costs for this building. So we're very, very grateful for that. As we know, during the pandemic, it took a lot of efforts and a lot of resources to get this building to completion. Our budget was way more than what we anticipated in the beginning, but thankful to the city for providing that grant, and also to IHP. I know Ben's here, and we'll hear from him in a little bit. IHP has been a wonderful supporter of ours, partnering with us in providing recuperative care, and we're working on adding other programming with them. They also provided a grant to us for capital for this building, along with funding mental health services and behavioral health services. We all know about 85% of the clients who experience homelessness suffer with mental health and other issues, and we have a wonderful behavioral health team from the support of IHP, so thank you for that. In this building, recuperative care, medical respite, we will be able to provide a comprehensive set of services, which will involve a medical team, case managers, substance use counselors, housing navigators that are going to work with each client who've been living on the streets for many years and get them through connecting to primary care services that they've never accessed unless they ended up in an emergency room at a hospital. So with that, we've been working closely with Hafsa and her team, the homeless task force, the police department, the shelter partners. All of us have been meeting and trying to come up with how we're going to serve this population that has been living on the streets. And the goal always is we want to get them into housing. So we have been working closely with IHP and are looking at projects in this area with the goal that as folks come into this continuum of care, meaning they come in, we get them stabilized, they get medical care, they get mental health. But what do we do after? Our goal is let's get them in here and then start working with them. One of the things we know that when we are trying to get folks into housing, they have to start at ground zero. They don't even have their IDs. So our case management department is going to work closely with them. And then we are working with many partners. We're already looking at properties in this area with the goal that anybody leaving out of this building will actually get into housing. So the whole concept is how do we disrupt the cycle of homelessness, but we can't do it without housing and health care. And in this building, under this one roof, we will be able to do that together, which is something we've been dreaming of for many, many years. And as Paul mentioned, we worked in the city of Riverside, but to come in and do our service model in a beautiful facility like this, we are so excited, and it's really going to be a wonderful experience for our clients who have been out on the streets and will actually be able to come in and be in a place where they feel safe and be taken care of. So with that, I want to share a story of a 22-year-old. We talk about homelessness. We're seeing children, we're seeing young women, men, all the way, elderly coming into our care. This is a 22-year-old who came into our recuperative care facility from the city of Riverside, and she had been working as a housekeeper and lost her job during the pandemic and ended up being homeless, and came to us through a hospital because while she was living on the streets, she got really sick. She ended up in the hospital with a very serious medical condition and was there for a while, and the hospital was like, we can't really hold on to her for that long because they're there for very acute medical issues. And this is where the recuperative care medical respite really helps the situation, because we can take people directly from the hospital and our medical team will be able to manage them. So she came in very sick. We were able to get her back on her medications, make sure she actually went to her doctors, and then continued to do all the things she needed to do. And today she's still very sick, but much better than where she was, she was almost dying when she got to the hospital. So at this point, she's still with us. She is working with our housing navigator and is very close to getting into housing. So that story just sort of reminds me, why it is so important for us to bring housing and healthcare together. And we know that in this building, we'll be able to serve many of those individuals out of here and actually get them into housing. So we're excited to, if you haven't already had a tour, show you, our facility, and really looking forward to working with all of the partners in the city, Helping Hearts and the Homeless Task Force, the police department. The goal is, how can we actually serve folks experiencing homelessness in a dignified way, but also do it in a way where it is costing the system a lot less. We know that there are many folks who end up in the emergency room over and over because they just can't access the care. So while they're here, they'll be able to access the care, and we'll be able to do it at a much more cost-efficient manner. So with that, I'm really excited to welcome you all, and hope that if you haven't taken a tour already, that you get to see the facility. Thank you.
So obviously, we're very excited about getting the programs in here and really getting started. But today is about the building. You see this beautiful building, and we always end up seeing what happens at the end, right? We never see what happens before. So I just want to invite Justin to come up. He project manages through the Kemp Brothers, and just to share with you about maybe a little bit of the process of having this.
Thank you for having me too. Kemp is not used to doing projects like this. We do a lot of large scale, 100 million plus kind of things, but I know Greg was in touch with Paul, our owner, and we're happy to do it, and in partnership with West Group Design too. Josh was the architect for this job, did a great job, and we did have weekly meetings where Michelle Davis, HOSFA, everyone was involved. Plenty of people have said it already, but the city of Riverside should be commended for how they helped this process move along. Chris Christopoulos was wonderful as a building official. And I've called Michelle Davis when we had emergencies multiple times, and it wasn't even her field. She would just get me in touch with the right person. So that's appreciated. But no, it turned out wonderful. The Illumination Foundation allowed us to do our job. They trusted Kemp to get the process done, and West Group Design, and our subcontractors, Caston, RIS Electrical, Procraft Plumbing, Couts Mechanical. They really should be commended because they did do right by this job and try and make sure that we came out with a quality product. So, but thank you, appreciate it, and can't wait to see the place.
I just want to also, add a little bit of recognition for our CFO, who I think lost a lot of sleep and some hair along the way in making sure this project panned out. Okay, so at Illumination Foundation, we really pride ourselves in our innovation and our approach that we always take in caring for our clients. And it's really refreshing to have wonderful working partners who are willing to engage us in pushing the envelope a little bit sometimes to really solving this homeless crisis that we're in. And so, they truly understand what it takes to really lift someone up and help them to become self-sufficient, and that's IEHP. And so I would like to invite Mr. Ben Haigi, representing IEHP.
Good morning, thank you. It's really an honor, privilege to be here and to work with Illumination Foundation. We've been working with them for many years and waiting for this day here to happen. We at IEHP, we understand the value of partnerships. We are a public entity. IEHP is a public entity for San Bernardino and Riverside County, and we provide Medi-Cal benefits to our members. And so this is a natural fit. We understand the value of providing housing and homeless services, and so we've invested in this for many years now, and we're excited that you're here because recuperative care is a natural pipeline for our housing program. We have a permanent supportive housing program at IEHP. We provide tenancy services, rental assistance paired with intensive case management services. So we hope to partner with Illumination Foundation here to not only bring people here to recuperative care, but take them to the next place, which is hopefully permanent housing. So thank you for the opportunity to work with you. Really appreciate the partnership, and thank you to the rest of the partners that have made this happen. It really does take a lot of us to help the Agneses of the world, and thank you for sharing that story. Thank you.
And of course, none of this would happen, and you've heard it. It wouldn't be possible if it wasn't for the city of Riverside. So I'd like to invite Mayor Patricia Locke Dawson to say a few words.
Thank you, Jack, and thank you, everybody, for being here. This is an historic day in the city of Riverside, and I have to give credit to all my colleagues on the city council who are here with me today. It's their political will that made this happen, so please give them another round of applause. So the story of this center is one of cooperation, and I think we all know that. You just said it takes a lot of us. It takes a village, right? That's an overused term. But, I mean, really, what do we have here? It's an historic day. We've got this project that's in the county of Riverside, led by the City of Riverside Office of Homeless Solutions in partnership with Illumination Foundation and IEHP with money granted from the state. So this is what it takes. This is what it takes, right, to make this successful. So this project really underscores the importance of prioritizing health equity for our homeless population, struggling with medical, mental, and substance abuse issues, as they lack the resources, as you mentioned, right? Lack the resources for a path to self-sufficiency. Recuperative care. It's a solution to the challenges that hospitals face. It's a piece of the puzzle that's been missing here in Riverside when discharging a homeless patient who lacks a safe environment to recover from their medical ailments. Illumination Foundation's recuperative care program provides a safe place to recuperate after emergency room or hospital discharge, preventing, this is a key word, right? It prevents a return to the hospital, which reduces the cost to our community, and it also alleviates the impact on hospital bed capacity. But what's most important is that this project prioritizes Riversiders. I don't know if you know that, but Riversiders get first crack at these beds. It's a regional center, but the priority goes to Riversiders, and I think Hofs is probably going to talk a little bit more about that. So this project emphasizes the importance of working collectively with our state and our federal partners too. I don't want to leave them out of this. So the City of Riverside received a total of $10.2 million in homeless housing assistance and prevention, or HAP, state grant funds. Through our direct advocacy from the Big City Mayors Coalition, of which I get to sit on. This is the top 13 cities by population in the state of California. And we are able to leverage that, the number of people that we represent at the state and the federal government to effect change for our cities. So it was that allocation that came to the Illumination Foundation, I think in 2.6 million, I want to say was right, for that made this facility happen. So during my first 8 months in office, I've been working with the coalition again in advocating for additional and sustainable funding. So I'm happy to tell you that we were recently successful in securing more money through the state for the next round of HAP funding, and it looks like we're going to be getting almost twice as much as that per year. So coming to that, yeah. So I do want to thank Governor Newsom and the state legislature. Please pass my thanks on to Senator Roth and Assemblymember Medina for allowing this to happen, for dedicating these HAP funding to our big cities and our counties, and allowing these partnerships to continue. So with that, I'm going to sit down and I'll give it back to Jack. Thank you so much for being here all today.
I have to wonder if it was, if this maybe was possible because you guys elected the second woman ever in 150 years to be the mayor of this city. Maybe that has something to do with it. I'd like to also invite Councilwoman Erin Edwards to come up and speak.
Good morning. Thank you all for being here. This is an exciting project, not just for the neighborhoods of Ward 1, but for our whole city. When you need help after a medical procedure, who do you turn to heal and to recover? We turn to our family, to our friends, to care providers. But not everyone just has such a support system to rely on. The opportunity for our residents who are experiencing homelessness to get the medical care that they need and deserve will be so impactful. Riverside's local community members will have priority access to the center and will have hope for healing with dignity, and that is such an important piece, with dignity. There will be opportunities to better secure their future with the oversight and support alongside the Illumination Foundation and Inland Empire Health providers. The facility and partnership underscores the value in addressing the ongoing needs of the homeless community. Creating a place filled with caring staff, with medical assistance and comfort will facilitate much needed healing. I am grateful for the tireless efforts of our mayor, of my colleagues on the city council, of our city management, of the Office of Homeless Solutions, for bringing partnerships like this one with the Illumination Foundation and IEHP to the city of Riverside. Working together with a forward-thinking approach allows us to provide real and meaningful solutions to homelessness and to its root causes. Thank you so much.
Okay. And last but not least, I also want to bring up Hafsa Kaka to say a few words. Hafsa is the first homeless service manager of the city of Santa Ana. We've actually had a long history of working with her, but she is currently the officer with the city of Riverside for nearly 2 years now as at the Office of Homeless Solutions, and she also leads a MAP home program. So Hafsa, you want to say a few words?
Thank you. Good morning, everyone. So I get the honor of being the face of the Office of Homeless Solutions. So yes, I am honored to be up here, but I am a reflection of all the hard workers that make this project a fruition. So first and foremost, I do want to be able to say thank you to our mayor, of course, and our city council for making this project. The political will is needed. The executive leadership from our city manager's office, our assistant city manager, we really understand that housing housing first and addressing homelessness is a priority for not only individuals experiencing homelessness, but for the community at large. So our leadership is very integral in making this happen. And then, of course, I want to be able to thank, of course, our internal team, Michelle. I call her mathemagician because the numbers just flow, and go to her for that. She's amazing. For the Office of Housing Authority Manager to really help move a lot of those pieces. And of course, our Office of Homeless Solutions, outreach workers and case managers. Ali Hariri is here. He manages the Hewlin campus, where we will see people come in every single day at the end of the day at 4:30 that they're looking for shelter. And some of them actually have a lot of wounds and a lot of health problems. So this is really where it comes to fruition. I want to thank Paul, of course, both Pauls, John, both Johns, with Illumination Foundation. You all have done an incredible job with your partnership, and I know Yvette is no longer with your agency, but we want to thank her too. I want to thank Justin. Your calls every weekly, we're not kidding. We were on that, and it was efficient, and we were right to it. So thank you with Kemp Brothers. You've made a very big difference. Chris Christopoulos with the city, our CEDD Deputy Director, Building Official, and of course Jennifer McDowell, the city's fire marshal and a woman, and of course Michelle Douglas, and then Todd Corbin and George Hansen from Riverside Public Utilities. I'm definitely missing a lot of people within the city. Internally, we work very closely together. I do also want to be able to thank our hospitals who are going to be referring in. You're the integral crux of this project, and it's really important that the communication is clear, so we'll be working on that. Also, as the mayor mentioned, the collaboration. We want to thank Michaela Cruz, Senator Richard Roth's office, Senator Medina's office, and of course all of the staff at the Housing Homeless Coordinating Finance Council who manage the grant for the Homeless Housing Prevention Funds. And you were correct, it is $2.6 million that the city was able to provide for acquisition and construction. So we're very grateful for the Big 13 Cities Coalition. And so with that being said, I want to, one more thing, say that as we tour this facility, one of the, and Terry, thank you, and all of our team that made today happen. I appreciate that, Phil and Margie. One of the most important things that I hope you noticed as you were walking around this facility is that it is trauma-informed care. From the colors to the way the building is structured, to the buildings, to the actual bed. I'm not sure if you saw the beds. They were very comfortable, and that's what you need to retain people in services. One of the other things about trauma-informed care is that people experiencing homelessness especially, they have experienced so much trauma. Some mental health, medical health. Our point-in-time count in 2020, we had over 500 individuals that were unsheltered, with over 66 experiencing physical disabilities that could potentially demise on the street if we don't have an infrastructure such as this. And of course, our mental health population, as we know, is in dire need of the support as well. So I'm very happy that there's going to be comprehensive wraparound supportive services. And with that being said, I would just like to say what this project meant to me. It reminded me of my parents. What you said, Councilmember Edwards, you're right. There's not a lot of people who have the support. We're so fortunate. My mom had a stroke about 10 years ago, and my dad has a plethora of, problems, but it's because we have that support system. And as I was working in this project, I realized if they don't have us, who do they have? They would be the next intake into this kind of facility. So I want you to be able to reflect on your family today and understand the importance that everybody is connected to someone. And I'm glad today we are connected. Thank you.
What a great way to end that. We are connected, and we are. I think you've all heard today that without each of you involved, this project would not have happened. So I feel like we should box it up and take all of you from city to city and just to say, hey, we have a best practice to solve the homeless issue. So, but hey, let's. This next part is what we're all here for, is the ribbon cutting. So Terry's standing right there. She's going to lead us out to the front, and we'll have a little ceremony and some photo op. Thank you for being here this morning.